Okay, good afternoon, everyone. I'm here to try to explain to you guys a little bit about one of the procedures that we do these days commonly in America for carotid artery stenosis. So, carotid artery stenosis is you've smoked or have diabetes, etc., cholesterol, you've ended up with a blockage in your neck over the years, sort of like a boulder, like with pebbles, maybe, and in a stream. And if one of those breaks off because it gets too narrowed, it can cause a stroke. It can go up and block one of the small up downstream blood vessels. In order to fix it, typically what we do is a traditional surgery called carotid endarterectomy. That's a procedure where we open your neck with with a knife, cut clamp below and above, right where the carotid artery is. Find the vessel, isolate it, so no flow is going through it, and then we clean out the plaque with like a spatula almost. Then we sew it up, but usually with a patch. Um, the other option is stenting. And to stent, you could either do what's called transcervical, meaning that they cut at the cervical region of your neck area and just pass the wire straight up and put a stent in. Or you could do transfemoral, coming from the groin. Now imagine you're going from the groin, it's kind of like you have a long, like noodle that you're trying to traverse and then get to that final spot and then do the stent. So you can imagine that it might be a little bit more challenging to traverse it safely. We've done it safely, but it is a little bit more challenging technically, and sometimes it is not done, perfectly. And a little wire may touch with one of the boulders and it travels to the neck. So we do this thing called transcarotid arterial stenting now, where they put, where we surgeons we make a small incision, so like the transcervical, so less risk of all the nerve injuries, etc. And instead of, before we even get close to where the blockage is, where the boulders are in the stream, we connect the blood vessel to your low pressure blood vessel, which is a vein in your groin. That note makes, and then once we clamp underneath, all the blood from the right side of the brain, or whichever side of the brain you're working on, will go backwards down this catheter and tube externally, and a little pump will suck it and pump the blood back into your vein, which prevents any manipulation of the rocks and the stream from causing a stroke to happen because it's all actually going backwards. So that is essentially how a transcarotid arterial stent works, and I think it's a wonderful procedure. There's numerous data points out there now which suggest that it is as equivalent as a carotid arterial stent. I think it's better than a transfemoral stent, and but it's as good as a carotid endarterectomy these days. So carotid endarterectomy, or TCAR, is my way of going these days.